In this chapter, we will discuss the concepts of research problems and research questions that evidence-based practice efforts begin with. What is research problem? The research problem is an enigmatic or troubling condition, a situation in need of a solution, improvement, or alternation. It's a discrepancy between the way things are and the way they ought to be. And most of the time, a research problem is an area of concern that identifies a broad range of interest, which means it happens among a population instead of only occurring to a single person. The problem statement is an argument. It speaks a research problem and provides a concise summary of what is to be addressed, an argument to support the need for new study. Problem statements generally introduce pertinent information about deficit in knowledge and provide information on why the issue needs to be studied. Another term is called statement of purpose or purpose statement. It defines the goals of the study and directs the development of the new study. In summary, in a research article, the researchers would describe their research problem by telling us what is being studied, why the issue is being studied, its importance in nursing practice, and the goal of the proposed study. You probably are working on selecting a topic for your group project. Where do you find the topic? Several resources can provide researchers meaningful problems to solve. For nursing research, nurses' clinical experience is an important source for research problems and ideas. If you haven't practiced in a clinical setting, you can read published articles, especially literature review articles. They include the current knowledge as well as the limitation and gaps to a particular topic. Or you can talk with the clinicians who are practicing and researchers who are conducting studies in the area of your interest and see what problems they have identified. Social issues, theory, and the designated research priorities by organizations serve as resources for research ideas too. As we talked earlier, problem statement informs the justification of the need for the proposed study. In order to do so, the statement would include a gap in research, conflicting findings, or omission of a group. It is usually interwoven with findings from the literature. Prior findings provide evidence supporting assertion in the problem statement and suggest a gap in knowledge. Some key phrases are often used, such as, little is known about blah blah blah. Findings of previous study are conflicting. Few studies on blah 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 have been done. It is usually clear and concise information. Here's an example of problem statement. The sentences at the beginning describe the scope, background of the study population, followed by indicating the gaps in current knowledge and significance or need of the missing knowledge. The problem statement is a prelude for the purpose statement. Here we introduce two concepts, quantitative study and qualitative study, which we will discuss more in next module and the rest of the course. The quantitative and qualitative studies use different approaches to answer the research questions and contribute to the problem solution. quantitative study serves better for the problems whose concepts are well developed and measurable, while a qualitative approach serves better for problems whose concepts are waiting to be developed. For example, look at the two studies I listed here. In order to inquire the relationship between cognitive function and work outcomes, quantitative study measures the variable using questionnaire and quantify them, then use inferential statistics to test the relationship. Qualitative approach, the second article, explore this phenomenon by interviewing a group of women who are carrying this situation, and then their words were analyzed to generate the concepts which help us understanding this phenomenon. The purpose statement, which defines the goals, is a single sentence or short paragraph that summarizes the essence of the study. A purpose statement is a concise, clear statement of the specific goal or aim of the proposed study. The purpose includes the variables, sample, and setting for a study, and usually the words such as purpose, aims, goal, or objective are used in the statement. In a statement of purpose, identification of key study variables, indications for the population of interest, and identification of the possible relationships among the variables are included for a quantitative study, which means all of the elements of a PICO are included. For a qualitative study, the statement of purpose would include a suggestion for the research tradition, which we will introduce in next module. Here I provide two examples of a statement purpose for quantitative and qualitative study. Please identify the PICO or PIO elements. What about if I modify the quantitative example as the aim of the study is to evaluate the effects of an 8-week integrated yoga intervention on physical function among women with lymphedema? What is the outcome here? Once the purpose of the study is clearly identified, questions must be developed that can measure what needs to be discovered. Research questions are sometimes direct rewardings of a statement purpose. You can always rephrase a statement purpose into questions. In many cases, research questions were used to clarify or lend specificity to the purpose statement. Ideally, the questions are broad enough to include central concerns and narrow enough to serve as a guide to study design. In quantitative study, the research question identifies the population under study and the key study variables, which are the PICO components, and the relationships among the variables. For example, does obesity increase the risk of developing lymphedema among breast cancer survivors? This question asks about the relationship between obesity and lymphedema incidence in population of breast cancer survivors. If you use the formula of PICO question in Chapter 2, it would be, for breast cancer survivors, does having obesity relative to obesity-free increase risk of developing lymphedema? The comparison here is obesity-free or not having obesity. An outcome is developing lymphedema. Qualitative studies are likely to ask how and why questions, such as the process, the meaning, and the descriptive questions. It stipulates the phenomenon and the population of interest. In qualitative study, sometimes more specific research questions evolve during the study. Researcher may begin with a focus that defines the broad boundaries of the inquiry. Identify the PICO elements from one of the examples on this slide and comment below. A hypothesis is the supposition of what will be found in a study. It is predictive in nature and typically used when significant knowledge already exists on the subject, which allows the prediction to be made. There are formal statements of the expected relationships among the variables. A hypothesis should always involve at least 2 variables and possible more. The differences between research questions and hypotheses is that research questions are the specific queries the researcher wants to answer in addressing the research problem, while the hypothesis is the researcher's predictions about the relationships among the variables. Usually you can reward the research question to hypothesis or the other way around. For example, there is a relationship between the patient's age and the likelihood of falling. This is a hypothesis. You can phrase it to research question such as, does the likelihood of falling have an association with patient's age? Take the second example as a practice and phrase it into a research question. Please comment below. Qualitative researchers usually do not develop hypotheses prior to data collection because they want the inquiry to be guided by the participant's view rather than by their own hunches. Another important thing is avoid to use the word proved or disapproved to describe your results in response to the hypothesis, because statistic analysis with data cannot provide the absolute truth. There are different ways to classify the hypothesis, such as by direction. Directional hypothesis specifies the predicted direction of the relationship. The phrase more, less, increases with indicate the expected direction of the relationship, while non-directional hypothesis does not stipulate the exact direction of the relationship, but just saying there's a relationship or association between 2 variables. Another way to distinguish the hypothesis is by the non-logic, which people set it to express the expected absence of a relationship. Often it's worded as no difference or as likely to be, where alternative hypotheses are statements of expected relationships between variables. It can be directional or non-directional. For example, significant differences will be found between treatment A and treatment B. This is an alternative and non-directional hypothesis. While the treatment A is more effective than treatment B in treating the disease X, this is an alternative and directional hypothesis. The textbook page 93 presents an example of the interrelationships among the terms we defined above. Please look at this example closely and review the definition of all the terms we discussed above. Here I helped you summarizing the differences of the quantitative and qualitative approaches in terms of their fits in research problem, purpose statement, research question, and hypothesis that we discussed in this chapter.